بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أهلا وسهلا. Welcome everybody to our fourth birth circle. So let's start with our dua. اللهم انفعنا بما علمتنا وعلمنا ما ينفعنا وزدنا علما. May Allah make this beneficial. And I'm going to dive in and start with introducing myself for all the new people because I see, mashallah, mashallah, lots of new people are here today. So my name is Hafsa Qureshey. I am a mom of three, Allahumma barik. My first was a very traumatic C-section, and that was almost 2 decades ago. So it's been 17 years since my C-section. And then I started on this pursuit to achieve a natural birth after a C-section. And I did, alhamdulillah, Allahumma barik, 13 years ago. But before that, so basically, I've been in this field for 14 years. Can we have everybody? Yep. All right. So I've been in this field for 14 years, alhamdulillah, helping parents, families, couples from their journey from pregnancy, birth, postpartum, breastfeeding, and beyond. Alhamdulillah. And my own journey started this way, that I realized, okay, once a C-section, always a C-section doesn't make sense to me. I'm going to try my best to have a natural birth. And alhamdulillah, I had 2 VBAC births in the last 14 years. And then alhamdulillah, I've helped over 1,500 parents, almost 2,000 now, with their natural births, home births, VBAC after 2, 3, 4 C-sections as well. Alhamdulillah, Allahumma barik. Even empowering C-sections. I'm a certified childbirth educator advanced from Amani Birth. I'm also a Lama certified childbirth educator, LCCE. I'm a graduate of the Amani Academy diploma program. I'm an advanced doula, postpartum doula, VBAC doula. I'm specialized in VBAC births because that's something very close to my heart. I'm also a breastfeeding specialist. I'm a lactation trainer, educator, child breastfeeding counselor as well, and currently pursuing my IBCLC, alhamdulillah. Also specialized in newborn care specialist, and biomechanics of birth. I founded my own company called Hafsa Qureshey Support and Services, not a few years ago, just not long ago. Alhamdulillah, just to be able to help more and more parents out there. That's my vision and mission of life now, alhamdulillah. So that's a little brief introduction about me. I offer online support globally. So I've got moms right now, even here. They're there from all over the world. So if you guys can pop into the chat while I go through the agenda and tell me where are you attending from. Now the chat is on the top left. If you're on your phone, it says it's like a little person. There's public chat there, so just click there. Or if you're on your laptop, you should be able to see it in front of you. Let me know which city or country you are attending from. Let's see where everyone is coming in from. Alhamdulillah. Yes, إذا بأي مكان أنتوا بالعالم كتبوا البلد कहाँ से आप लोग join कर रहे हैं, किस शहर से, ज़रूर लिखिए chat के अंदर. All right, so we have Karachi, Islamabad, Lahore, Abu Dhabi, Dubai, London, UK, Pakistan, Karachi. I am originally from Pakistan, by the way, but born and brought up here in Kuwait. That's why I speak 3 languages, alhamdulillah. So that's why I said, you have questions, you want to share, you can in any of the 3 languages. All right. Alhamdulillah. Okay. All right, so what are we talking about today? Today's agenda, of course, is starting with setting our intentions. And then there is going to be affirmations debriefing. I'll be sharing things from you guys. So there's going to be a link for you guys to share your journeys, anything that you're going through right now. So we'll read through that. I'm going to share some birth stories. We've had some amazing births I've had in the last 2 weeks, and I felt like I need to do something. I want to get it out there, tell you guys about it. So keeping it very confidential, I'm going to share about those births, inshallah, specifically 6 births that I'm going to have on the screen. So just stay tuned. I love sharing birth stories. I love birth stories myself. All right. And then I'm going to give you a little bit about how to make informed decisions, inshallah. And then, of course, we're going to have our question and answer session, inshallah. That's the agenda for today. All right. Alhamdulillah. So starting with setting our intentions. I want today, all of you that are joining, to sit down and start with a growth mindset. Think of yourself as a newly born baby, a child who's not being influenced by anything. Because there was one of my moms who recently gave birth, mashallah. She shared something very beautiful with me yesterday, and it sat with me. She said, when we are born with our fitra, we're like reconnecting back with our pure self. When we are born, the fear of all different things that this life holds is not there. So let's connect this with what I have to present for you guys, which is birth. Now, the fear of pain and birth, and oh my God, what's going to happen? And oh my God, I'll be treated this way. This wasn't there, right? Where did all this fear come from? It came from what we were told. It came from what we saw, like in the movies and pictures, what we read, what other women shared. So think of yourself as the pure newborn who did not have this fear. For that pure person who does not have influences increasing this fear, birth is a natural life event, how it should be. It should not be something that we are dreading. That is what mankind have been doing for all these years, subhanAllah. And then the next natural thing is, of course, breastfeeding. So these are the two topics that my emphasis is always going to be, birth and breastfeeding. So just like we know how to breathe, let's take a nice breath. Just like we know how to eat, just like we know how to go to the bathroom, Tikramun, all these things happen very naturally to us. No one freaks us out. If you go to the bathroom, something's going to happen to you there. No. No one tells you that, oh my God, if you're going to eat, it's going to get stuck in your throat. No. So where's all this fear that, oh my God, what's going to happen with me coming from? It's coming from what has influenced us. It's coming from what we're told. It's coming from what we see. So let's renew our intention and think of us that let's go and try and reset. I know we can't erase it, but this is where unlearning and relearning happens, right? This is where I want you all to reconnect with your fitra, with your creation, with your takhliq. To all the women attending, because I know there are some babas attending, and please, I'm more than open to having husbands attend my sessions because I feel a husband's support can make a big difference. All right? So subhanAllah, I want you all to take a moment and think that just like I do everything else in my life naturally, this is also a natural event of life. We have over-medicalized it. The society, the media, the movies, I don't know, whatever is out there, social media nowadays. All of that has messed up this mind. It has made us disconnect with the natural fitra we had. It has made us start thinking that something's wrong with me. That, oh my God, it's something scary, it's something I cannot do. Right? And as Muslims, we need to think that my Allah has created me complete. Tabarakallahu ahsanul khaliqin. Allah has created me complete. There's nothing wrong with me. And Allah will not put me through something I cannot endure. These are constant reminders we need to remind ourselves. I want you to today sit and think of how you wish to grow from your experiences in motherhood, rather than letting fear hold you back that, oh my God, something's going to happen. I'm not going to leave my house. So think of every event of motherhood, of course, starting from preconception, pregnancy, labor, birth, breastfeeding, weaning, and so forth. That every moment that comes in our life with this little baby that is entrusted to us is a moment of growth. It's a huge blessing. So we need to think of this as, okay, it's going to help me grow as a female, as a mother, as a father, and it's going to help me I need to find ways that I thank Allah for each of these growths. I need to find ways that it helps me reconnect with Allah subhanahu wa ta'ala as well. And reconnect with my instinct, with my instinctual part of my brain, with my fitra, because this is what it was created to do. All right. So I want you all to start with this. Next up is our sharing circle, which I did send the link. I'm just going to grab the link again. Where did I put it? And send this to all of you. Okay. There we are. I'm dropping the link in the chat. And I have sent it in the WhatsApp groups as well, if anyone wants to share there. So there is the link. Let me just send it again in the chat. Okay. And then I'm going to start reading through those. This is a sharing circle. Here, I want you to share anything from your pregnancy, birth, labor, postpartum, motherhood journey. This is why we have these virtual circles, right? So I'm just pop the link in our online events groups. Okay. If you're not in the group and you joined from an external group, just check the chat of our session right now and you'll find the link there. Okay, so let's go in and start sharing. All right. So I hope you all can see the screen. Yes, you should. Okay, so let's start from the bottom. Someone says, birth journey was smoother than I expected, alhamdulillah. But breastfeeding, I feel like giving up. And I can understand, حبيبتي. ترى إذا عندكم أي شيء that تبون تشاركون فيها بالعربي حياكم الله كتبوها بالعرबी. अगर किसी के पास उर्दू में कोई चीज़ share करने की है, please go ahead उर्दू में उसको type कर लीजिए. And of course, if anyone wants to share anything in English, go ahead. So this mama says the birth journey was smooth, but smoother than she expected, but she's breastfeeding right now and she feels like giving up. Let me tell you, you're not alone. And it is okay to feel this way. Because yes, breastfeeding has its challenges. Especially if you feel like something's not going right, if you're struggling with any part of it, right? It could be a bad latch, it could be a painful latch, it just could be the baby nursing again and again and again. If you want to go ahead and share, again, use the same link. And Shisma, share, 1 second. Okay, we have started. All right. Yeah. All right, so if you want to share specifically what you're struggling with, I'd be happy to help. I am a breastfeeding specialist as well. Okay. 1 second. All right. Next one says, everyone is discouraging me for a VBAC. What do I do? So VBAC is a vaginal birth after a C-section. And I'm sure, subhanAllah, there is a lot of fear behind VBACs in our society, around the world. Let me tell you a little bit about my journey. I don't know how many of you know my VBAC journey, right? Okay. So when I started off my VBAC journey 14 years ago, was it? I was faced with a lot of friction, basically. I started with educating myself. So I was also very doubtful. I was scared. My mom had had 4 C-sections. My sister had had 4 C-sections. I was very scared. But when I was like, I can't go through another C-section. It was so traumatic for me. I needed a place that, or somehow something to tell me that I can do it without a C-section. And this is where I started to take birth classes, alhamdulillah. That's around 15 years ago. And that is where my perception changed, that yes, it is a safe and appropriate choice. And this was backed by research. I got my husband on board. He was always supportive, like in that sense. Alhamdulillah. And I think him educating himself with me made a big difference also. What do you call it? And eventually, when I started my doctor shopping, in the classes, we're taught how to doctor shop. There's no one doctor who's perfect, right? Everyone can have different preferences. So eventually, when I did start my doctor shopping, I had to change 18 doctors. It wasn't easy. It was financially hard. It was mentally taxing. I had doctors tell me, Hafsa, you can't do it. We didn't do your first C-section. All this noise, this resistance. I changed 18 doctors. It's not an easy number, believe me. There were times I was like, La khalas, you know what? I'm not just even going to try for a second child. This was even me before planning planning pregnancy. But then gradually, alhamdulillah, my knowledge helped me. And gradually, subhanallah, I started to feel more confident. Whenever I went doctor shopping, I was very clear with what I needed. And all of this happened. Those of you that want to share, check out the link in the chat. Okay. You can just click the link and start sharing any questions, or not questions yet, but anything you wish to share. Okay. And then subhanallah, I felt that confidence increasing in me. And then what I did learn to do, which I advise to all of you, and especially you, since you are facing that resistance, is do not over discuss anything about your pregnancy or your birth plan, what you're planning, like you're planning for a VBAC, with anybody who's not supportive. My own mother was not. So she thought I was cuckoo. Like, you know, what is she doing? Right? Because Hadi, C-section, so what? Right? But subhanAllah, now she's my biggest support person. Even during labor, like we live in the same building, I did not inform her early labor, only when I needed her to, take over the kids and stuff. That's when I did. Right? So subhanAllah, it makes a big difference when you are trying to set boundaries and you're trying to shut off noise that could possibly have more of a negative influence, that people are constantly telling you, don't do it. Whereas you have the knowledge. I hope you have the knowledge. If not, please sign up with my birth classes. We go through the VBAC component in detail. And this is something I've been working in the last 14 years. Like VBAC is my favorite passionate topic, right? So as long as you feel you have the knowledge to stay strong and build your confidence, don't overshare with people who's discouraging you, okay? And if no one else, like I always tell my mamas who sign up with the classes, I will support you. My first birth experience wasn't very good. I wasn't taken care of properly after delivery at the hospital. I'm now pregnant with my second baby, and I really want to have a better experience this time. What can I do to prepare and make my postpartum recovery better? SubhanAllah, I'm glad that you're thinking of that. Like, I will answer this. It's more of a sharing, but it is also a question. So I'm kind of going to share back in this, but question and answers are coming later. I know some of them would merge, so it's fine. For me, pregnancy, labor, birth was the easy part as well. But the immediate postpartum care, all of that can be tough. So as long as you're fine, the baby checks out fine, you can leave early from a hospital that might not be providing the best care, because sometimes just being at home and being more comfortable is better. Second thing I would say is that have a postpartum plan ready. Like literally, just like we write a birth plan, right? These are my birth wishes. Have a postpartum plan. That this is the plan for my child, older child or children. This is my plan. This is how I'm going to manage visitors, and sit together as a couple, go through them, right? And when you have it planned out, when you're both on the same page, that just automatically, and you can see where the little gaps are. Okay, this is where I need support. Maybe I need to hire somebody to cook. Maybe I need someone to help me with this. So you would be able to fill the gaps where you see them instead of just winging it. Okay. So really, I would help that. I would highly advise that. If you're considering a home birth, I hope you have a care provider. That's the first thing. Second thing is I hope you have educated yourself, taken detailed classes. So make sure you have a doula is not a care provider, by the way. By care provider, I mean a doctor or midwife, right? A professional one. Um, and you are speak to the midwife. She would be able to guide you. She would have a backup plan for you. Don't go into it blindly at all. Okay. Inshallah. All right. It is your first trimester, 5 to 6 weeks pregnancy. Suffering nausea, dizziness, weakness. I don't feel like eating anything, and because of not eating, I'm getting weak. Yes, because nausea just takes a huge toll on us. So I would highly recommend smaller snacks and meals, right? I don't know if you've signed up for the birth classes. We have like a 20 tips. I can't share it here because of Amana, it's copyright. But if you do, inshallah, those tips would help you with the nausea. Some of those tips are really super duper helpful. But I do advise smaller meals and snacks, and an empty stomach is going to be more nauseous, right? And see what's triggering nausea. And even after the tips are not helping, look into homeopathic solutions. And then, if needed, last resort should be medication. Okay. Pregnant with your second child, firstborn is 2.5, good gap. Alhamdulillah, you had a terrible postpartum experience because of breastfeeding. All right, the baby didn't latch. And you had episiotomy stitches as well. All right, so I would definitely look into making sure that you can avoid an episiotomy this time. So I hope it's where am I? Yep. So I hope it's part of your birth plan already. Okay, inshallah, and working on it during pregnancy now with your pelvic floor. All right. And preparing that and making sure you inform them that, inshallah. As for the latch, look, a good latch is way more than just putting the baby on the breast. We need to make sure that the baby opens nice and wide, right? I'm trying to find the baby. So always try to aim the baby's nose, right, towards the nipple. And that just helps the baby to open nice and wide. Okay. And then you are bringing the baby to the breast. So when you aim the nose to nipple, it helps them open wide and then take in a deeper part of the breast so that the nipple part goes in deeper. It's not clamped down on the harder palate. The nipple needs to go in deeper. And there are positions, especially the laid back position, where we put the baby face down, that can be super helpful. Okay, inshallah. And see around you who can help you physically with the latch as well. Okay. My whole journey from pregnancy to birth and even afterward has been a complete blessing. Allahumma barik, mashallah, Allahumma zid. It's not like I didn't go through any awful symptoms, but I navigated them by reflecting on everything very deeply. I always used to study the what ifs and if nots of pregnancy about everything that would have gone wrong, especially since there was often a high chance of things going otherwise. But I saw the miracles of Allah subhanahu wa ta'ala at every step. SubhanAllah, one of the stories I have today, the birth stories, is all about miracles as well. For the fertilization of the egg to the implantation, the initial process, development of the fetus, to the placement of the placenta in the best suited area. Indeed, subhanAllah. I mean, isn't this what Allah tells us in the Quran as well? To a fully functional umbilical cord, to the growth of our full limbs and other organs, to the just right amount of amniotic fluid, the right size of the pelvic bone, and lastly, the perfect ripening of the cervix. Subhanallah. I love it. I love how you wrote that. The development of a baby and its birth are miracles. Everything is a blessing. If you start seeing pregnancy this way, we will be thankful to Allah every single day for every single blessing He has bestowed upon us. Subhanallah. I just loved reading this. This is the kind of sharing I just love. I hope all of you found it inspiring. And the sister that shared it, may it be Mizan Hasanat, and it increases in your Hasanat as well, inshallah. MashaAllah. Beautiful. I have many feelings during my pregnancy, especially with my body change. Otherwise, I feel lucky that I still am working out and continue normally with your life. I'm extremely worried how to give birth, if will be available to do it naturally. Inshallah. Look, our body is going through a beautiful change, right? Especially for women, it can be hard to accept, especially in a society which is always, It's all about how things look. So embracing this beautiful change because your body is growing a miracle, just like we read, subhanallah. I hope that this previous sister's statement really helped you, right? So that helps us embrace it, right? And accept it. However, about birth, do look into preparing yourself for birth, educating yourself for the birth, looking for, so that you're looking forward to it also, inshallah. Okay. And the fact that you're still working out, all of that is beautiful. You do your part, right? Don't leave any stone unturned. Do your part to prepare yourself, right? When it comes to especially your nutrition, your exercise, all of that, and doctor shopping, having a birth plan, all of that. Okay. And then we do tawakkul. The next thing is tawakkul. So we tie our camel and then tawakkul, inshallah. Pregnant a second time after 9 years, mashallah. First pregnancy 2017, birth naturally two healthy babies. Age gap was a personal choice. Of course, I can totally understand that. PPD was the scariest part, postpartum depression. Now, since you know you had it before, I hope you have a good therapist that you can debrief to and you can take counseling, and regular ones, not just one or two. Okay, so that's just a little reminder. I'm sure you know how to navigate that, but just a reminder as a professional that don't, especially if you've had it before, there is a chance of relapse as well. Okay. When it comes to twins and supply, right? Especially if it was twins, I'm sure it's hard, right? And you're breastfeeding too, and it just gets overwhelming as well. So inshallah, you can definitely breastfeed this time. I have had a lot of requests for my breastfeeding workshop, which is coming up. I'm hopeful soon. I don't know. I haven't set a date yet because my summer plans are still up in the air at the moment, but inshallah. So I would highly recommend looking into that. Since you're due just next month, you can reach out to me on direct. I'll share my contact details in the end. And you can do it sooner than later. I have the workshop always available. All right, pregnant with the third baby, two C-sections earlier, you want a VBAC, can't find a VBAC supportive hospital. Rewind, reverse things, right? Don't start with the doctor or hospital part. Start with yourself first. I've had mamas with small gaps, even after two C-sections. Some of the stories you can find on my Instagram. In fact, one of them I recently shared. They managed to have a VBAC even without a supportive care provider. I know it's ideal if you can find one, but not everywhere. But subhanAllah, mashallah, it was 18 doctors shopping 14 years ago. Now, alhamdulillah, we do have a lot of supportive care providers who are getting convinced because of the awareness you mamas are taking to them. Okay? So yeah, do your part to educate yourself, having a birth plan, continue your doctor shopping. Remember, you need to be the one making decisions, not anyone else. Okay? This is not pregnancy or birth related, but in general, many moms think that this is just modern stuff, that their son needs to be tough with their wives and the girl needs to be with their mother, and that's it. It's heartbreaking in hearing. It's not a big deal. You should not. Well, yeah. I hope that, because it's not birth or breastfeeding related. So I'm not going to go into that discussion here, but maybe look into couple counseling if that's the case. 20 days postpartum, mabruk on the baby, first of all. Second thing is struggling with breastfeeding. A low milk supply. Look, when we give birth, our body has everything it needs to breastfeed the baby. Okay? And subhanallah, what we need is people having faith on us and frequent stimulation. So the more you nurse, the more there is stimulation happening here, the more your supply will increase. Every time we add a bottle, every time we are not stimulating it frequently enough, the baby can ask every 10-15 minutes. That doesn't mean your milk is not enough. That just means that the baby has a teeny tiny belly that fills up fast and empties fast, right? So understanding the mechanism behind breastfeeding helps us. And then, of course, having a supportive position so that you're not getting tired. Because for me, yes, breastfeeding is amazing. We want it. But for me, a newly postpartum mother and her being comfortable is equally important. So finding a position where you're getting your rest, such as the laid back position or the sideline position, these would be helpful that the baby can be on you for hours, and inshallah that would help. Okay. uh Engorgement, bad latch, yeah. Depending, I would want you to see somebody in person for about if the latch is bad and it's painful. For engorgement, you can do like cabbage leaves, warm compresses, lymphatic drainage massage. We call it breast gymnastics. Very interesting, something new, but very super duper effective. Okay. My baby's 6 weeks old now, totally on breastfeed. MashaAllah, well done. Her birth weight, the birth weight would always go down. I do not recommend checking the birth weight. Like, you need to know the birth weight, and then you need to know the 1 month weight, and then it should be an incline, right? As long as the diaper count's good, she's feeding frequently enough, these are the things we look at. 2 C-section kids after second birth. I had 2 post-op surgeries. Oh my goodness, I'm so sorry. That sounds so traumatic. Just want to share C-section is not the safest option. Thank you so much for sharing that. Yes, C-section is a major abdominal surgery. It should not be taken lightly. Thank you for saying that. And I agree with it. I'm a C-section mother myself. How did you overcome the fear of having another C-section when you were pregnant second time? I educated myself, and I made sure that I knew that trying for a VBAC was a safe and appropriate choice. I did everything in my power to make sure that, yes, I'm trying my best to get my VBAC. I surrounded myself with support. That is what helped me to overcome it. And then lots of debriefing. So if there is PTSD, so therapy, debriefing methods, you need that sorted out. Because if you have birth trauma, which I did, birth trauma is true, right? It affects our mental health. So if you had previous birth trauma, please, please, please don't ignore it. Seek professional help. Okay. Lactation consultant said that your nipple size is big and baby's mouth is small. That is why he can't latch properly. Had to pump and feed him via spoon. It got better after 3 months. He got breastfeeding jaundice when he was 1. Jaundice is a very, like many babies would get different kinds. The more you feed, the more it gets flushed out, right? So don't worry too much about the jaundice part. I'm glad, alhamdulillah, that the baby's latching now and the feeding is getting better. All right. Precautions for VBAC, when to be really worried. So, again, I teach birth classes over 10 weeks, like 10 sessions. So I can't summarize that in a 1-hour session right now here because it has a VBAC component that's included. But in general, the risk factor of uterine rupture, the separation of the scar, is less than, after 1 C-section, is less than 0.2%. That means 99.8% it's not going to happen. And I have helped over 2,000, almost 2,000, not over 1,500, almost 2,000 moms in the last 14 years. And from them, VBAC has been, I don't know how many, I've lost count. And I've had only 2 cases, you could say in 1,000, that had started to have some sort of scar separation. One of them, there was the wrong kind of induction involved. And then she went in and she had a repeat C-section. The other one, she started to have sharp pain in her part of incision. She got an ultrasound and it was detected the separation. So she went in and got a repeat C-section. But it is extremely rare. Like, look at the number I'm telling you. This is my personal experience. So statistically, I haven't done a research on this, but there is proper research out there, right? That is saying now the risk of uterine rupture after 1 C-section is 0.2%. After 2 C-sections is 0.7%. That just means, I mean, logically, which number would you go on? Would you look at 99.8 and allow yourself to go for a trial of labor? Or would you look at 0.2 that, oh my God, no, my scar is going to open up. I'm not going to go. Let's just go for a C-section. I mean, I'd respect you for that as well. I totally understand. But just see the pros and the cons, educate yourself, and then, of course, istikhara alongside and then decide. Okay? Precautionary wise, I would just say your nutrition, exercise, your knowledge, making informed decisions, you being the one deciding, all of this makes the big difference. colicky baby, I would do baby wearing. I think with colic, and I just feel colic is so overrated. Just because if the baby's crying, we label it's a colicky baby. I'm not saying yours isn't. I don't want to dismiss that. I totally understand. It possibly could be. But lots of baby wearing, lots of skin to skin, and carrying your baby and nursing and keeping the baby on the breast can really help with this as well. And lots of tummy time, obviously, as well. Okay. All right. I am going to pause this one and come back to this because now I have something to share. All right. So we are pausing this, stopping this one, and we are unlocking the Q&A. All right. So what am I sharing now? I am sharing birth stories with all of you. Oops, sorry, that jumped. I'm sharing birth stories with all of you. Are you all ready? Anyone who wants to hear about these birth stories? And the stories that you see on the screen are the birth stories. So I'm just going to quickly tap in and let you guys know that we are sharing birth stories now. Okay. If anyone wants to just jump in, because a few people were saying they were here for the birth stories. Okay, birth stories time now. Okay. Let me just add the link. So if anyone wants to join that. All right. Okay. So let's start with, first of all, thanking Allah subhanahu wa ta'ala for amazing births that are happening around us. Allahumma barik. Allahumma zid fazid. And I can't, I mean, this last week was so humbling. It was super special for me. And I just felt very much connected to Allah subhanahu wa ta'ala with each birth. Because literally, whenever a mama is in labor, or she informs me that she's in labor, or she informs me that, and these are all moms that have educated with me, taken classes with me. These are mamas who went ahead and possibly hired me as well as a doula. Not all of them did, but even then, like I always say, my support never ends with the classes, right? So starting off with last weekend, our weekend is Friday, Saturday. So Thursday evening, I had two moms going to labor. One of them was, mashallah, a VBAC mama here, and I was her doula as well. And we had met recently. We had talked through her birth plan and everything. And I'm keeping, again, everything. I'm not sharing details. I'm just sharing the part she would be okay with me sharing. Just a little disclaimer. So alhamdulillah, we had gone through her birth preferences. That's why these birth stories would be brief. When they share their detailed story with me, I'll be putting them as a post on my Instagram, inshallah. Okay. So this VBAC mother, alhamdulillah, she actually was juggling between two countries, whether she should give birth here or in another place. And then she decided, la khalas, she's coming here, she's here. She had options of two hospitals, one private, one government. And alhamdulillah, her labor started. For me, everything seemed to be going fine. But she started to have a few of the complications, like she was starting to see some bleeding. It wasn't that much, but I can understand for a mother who hasn't experienced labor, or I think she did, but just was something new she hadn't experienced before. So I said, you know what? You could go ahead and get things checked just to make sure all is well and then come back home. Now she's already having these contractions, mashallah. So subhanallah, I tell her this, and it's around Tahajjud time. Like I say, for every single mother that tells me that she's in labor and stuff, even if she's not hired me as a doula, I always make sure that I'm praying for you, I'm giving sadaqah for you. If it's tahajjud time, I'm doing tahajjud, I'm doing nafil. So that connection keeps me. So Allah was giving me opportunities to do more ibadah for Him. So I'm so thankful for that. I'm thankful for each of these moms here for this. Alhamdulillah, Allahumma barik. And this, and then I tell her, you know what? You can go get things checked just for the peace of your mind. It has to be your decision. I suggested to her, and she was comfortable with this decision. And then she tells me later that, okay, I ditched the private hospital because I was like, you know what? This is something that might be scary. I'm probably going in for a repeat C-section. Let me just go to government. Why pay more in the private, etc., etc. And that made sense. I was like, yeah, sure. SubhanAllah, she goes there. I don't hear from her. I kind of, I was like, again, more du'as and stuff, because in government, you don't stay in touch anymore. Like, they don't allow anyone in. You don't have your phone, nothing. And then she calls me approximately 3 hours later that she had her VBAC. And alhamdulillah, when she reaches there, she was a lot progressed and it was nothing to worry about. And they said, like, khalas, like, by the time you go back home and come back again, you might give birth in the car or at home. So subhanAllah, things progress super fast. I think she just needed some affirmation at that point that what was happening wasn't scary. And then alhamdulillah, things progressed from there. And she had her beautiful VBAC, which was so amazing. MashaAllah. And then this first time mama, this mama is one, her birth story is one that really is close to my heart. She took classes, all of these moms, by the way, the ones that you on the screen, they're all my blessed mamas. I call them my blessed mamas because they've taken the Amani Birth Blessed Start course with me. She was having pregnancy complications, for which, very validly, she did need an earlier induction just for the safety of her and her baby. And her pregnancy had seen lots of ups and downs. But subhanAllah, like literally a day before her induction, her body decided to go into labor naturally. And that was like the moment I heard that, the moment her husband shared this, I was like, subhanAllah, right? The body knew that, okay, now it's getting a bit too much for the baby to stay inside. Let's just start things naturally. And this is the faith. This is the tawakkul. This is the du'as. This is the sadaqah. This is the miracle of birth, subhanAllah, right? And I think at every moment she faced a complication in her pregnancy, like the du'as that came from my heart, because I could see her trying so hard, like I'm witness to it, subhanAllah. And then, of course, mashallah, her husband was amazing as well. She had a local doula. She was amazing as well, mashallah. Like literally, she didn't leave any stone unturned, mashallah. And alhamdulillah, labor progressed the next day. So Friday morning, we heard from the VBAC mama, I heard. And then by afternoon, evening-ish, mashallah, this first time mama, she gave birth naturally as well. And then I was like, okay, I've been up all night. It's weekend. I'm just going to get into bed. And then my mama, who was I was her doula as well. After 2 C-sections, she was trying for a VBAC. Amazing woman, like mashallah, her strength. Like, subhanallah, mashallah, that's all I have to say. Amazing. I was a virtual doula because she wasn't in Kuwait, she was in Bahrain. I just love her. And like her preparation and the things that she would do to help work with her mindset and everything, just simply beautiful. And her labor starts, like she was having all these Braxton Hicks and prodromal labor signs all this time. But then her labor starts, mashallah, and alhamdulillah, in the night, things pick up, things start getting intense. We're talking, I'm guiding her. And then she says, this is getting too much, I'm going for a C-section. And I was like, aha, that means now is the time. Things are going to happen super fast. And that's exactly what happened. When a mama starts showing me signs of transition or of giving up, I was like, okay, this is where that last little push is needed, right? So I told her, La, I'm not going to let you give up now. You're almost there. Khalas, you're done. And literally, khalas, she was done. Alhamdulillah, she reaches the hospital, I think within an hour, if I remember, like, mashallah, there's been so many births. She gives birth. She has her VBAC after 2 C-sections, and she's just amazing. And her sister's messaging me. It was amazing. It was beautiful, mashallah. She did it. So she had a vaginal birth after 2 C-sections. She labored like most of her labor, khalas, was at home, which was amazing because of her knowledge and how prepared she was. And then there was this mom, this third time mama, mashallah. She took classes with me for her second pregnancy, and this time she was in touch, and she had crossed 42 weeks. So she's 41 weeks. We were talking. She's getting anxious. Oh my God, Hafsa, nothing's happening. And I'm like, relax. Are you okay? The baby's okay. Alhamdulillah, all is well. Then in the middle, there was, I remember one of the days she was like, you know what, I'm going to go get things checked. I said, yeah, sure. She's talking to me about induction options. But alhamdulillah, since everything was well, she was okay to wait. And then, mashallah, just labor started, 42 plus 3. But she wasn't waiting blindly. She went, she made sure she was okay, the baby was okay. And once labor started, it was super duper fast. Like, it was literally, I call them catch babies. So like, you're reaching there in the hospital, just ready to catch the baby. That's it. Alhamdulillah. So yeah, the baby doesn't know it's 42 weeks inside, right? Every baby develops differently. The baby is not Cinderella's pumpkin, like I say, that at 40 weeks is going to turn into a pumpkin from a baby. La, alhamdulillah. And then there was a mom who got a condition happened to her at 39 plus weeks. She tried to manage it with medication. It did not help. It was starting to impact her baby. And for the well-being of her baby, alhamdulillah, she made an informed decision, and she had an empowering C-section. And mashallah, I'm proud of her for the decisions she made. So that was the 5th baby that happened, mashallah. Very strong mother, alhamdulillah. She tried her best. She did everything that she could, even then if things were not under control. Alhamdulillah for the decision she took. Alhamdulillah for C-sections in such situations, honestly. And then the last birth was yesterday. The VBAC after 2 C-sections. And this mother as well, when all of these other births were happening over the weekend, I would hear from her on off. Her things would pick up at night and then fizzle out during the day. And I was like, this is subhanAllah, Allah is giving you time to sleep in the day, to kind of catch up your energy so that you're ready for the marathon waiting for you at night. And I kept encouraging that each contraction, all of this is body preparing. And then the third night she goes, something feels different, Hafsa. It feels stronger. I'm like, yep, who knows? Maybe the baby's going to come. And subhanAllah, again, she messages me yesterday morning that alhamdulillah, again, a very catch situation. She reaches the hospital and she's like, there was no time for me to, go through the specific channel that I get this done and this done. I was like, no, the baby's coming. And alhamdulillah, she gave birth, and this was after 2 C-sections as well. MashaAllah, Allahumma barik. So this was my sharing circle about the birth stories that are around us. And the best part, the combination of all these births was the informed decisions these amazing mamas made, right? They used their brain tool, like literally the brain. They looked at the benefits, they looked at the risks, the alternatives, what their gut and intuition was saying, and if they wanted to delay, just to make, look at that mom, 42 plus 3 weeks, mashallah, right? She just waited. If everything was fine, she just waited, all right? And with the eye, I would add istikhara. So you don't have to do the istikhara the specific way that, my God, you're going to read and sleep and something. No, you can constantly be reciting the istikhara dua so that Allah puts khair in all the decisions you take, and Allah guides us to make the right decisions, inshallah, right? So using your brain tool, it helps. Now, how to know what are the benefits, how to know what are the risks, the alternatives, this is where your knowledge comes into play. And this is why I emphasize so much on educating yourself and preparing yourself, right? Many people tell us if you're going to the hospital, the doctor is there, why do I need to educate myself? You need to, because you need to help reduce fear and anxiety. You need to build your confidence. Right? You need to do the informed decisions. No one should be making decisions for you. And for informed decisions, as you can see, it's 2 words. The decision you need to do, but in order to make the decision, you need information. Where do you get this information from? This is where structured, proper birth education classes make a huge difference. All right? So using that information to help make decisions makes a Big, 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 big difference. So you feel in control, you feel confidence, and it helps you with communication. You get the confidence to be able to communicate your birth wishes, your wishes. Like, you don't feel demeaned, you don't feel shut down. Well, you don't know, you're not a doctor, right? You do not feel dismissed because you have the knowledge from where you're talking about. Birth is not a medical condition. You're pregnant, you're not sick, right? And this helps with a more positive and personalized birth experience. You're not just a statistic that is going into a birth center or a hospital and walking out. You're an individual who's going to live with the experience the rest of your life. The doctor is going to birth 30, 40 babies a day and go home and sleep. Your experience is going to stay with you the rest of your life. It's been 17 years since I had my C-section. And it's so vivid because that was the biggest trauma of my life. We take our birth experiences to our graves. We take how we are made to feel after birth, before birth. This is a time where she's vulnerable. And this vulnerability is something my Allah has acknowledged. Wahnan ala wahn. It's hardship on hardship. So if anyone's dismissing that, or if anyone's demeaning that, I'm sorry. You are wrong. And for this, to make this hardship easier, if knowledge, if educating ourselves, if getting the support, sometimes more than knowledge, just having someone you can reach out to, someone you can talk to, can make a big difference. All right? So inshallah, I hope you all get that support and knowledge that you deserve. And this brings me to our question and answer session that I am going to, it's the same link, right? Let me just copy paste the link again. Yeah, I'll be happy to share this istikhara dua, inshallah. All right, so you guys can just pop in, and now when you click on the link, you can start asking your questions there. Okay. And I'm going to answer the questions and then share about the birth classes. Okay. All right. Okay. And if you can't find the link, or if you want to type in the chat, I'll be happy to answer there as well. All right. So these are questions. I know some of you did ask your questions already, but you are more than welcome to ask them here. Okay. I'll give you guys however we would time. Yeah, so we can do question answers for like 5-10 minutes. Any specific question you have, I'll be happy to answer it there. Okay. Not unmuting. You have to type your question, please. Yes, I can't because mashallah, there are so many of you out here. So I would prefer if we do it. Yeah. Mm-hmm. Okay, I'm just going to share my screen. So go ahead and ask your question. The link is in the chat. So just click the link if you want to leave your question there. So uterine rupture, the signs of uterine rupture would be sharp pain in the site of the incision, right? And it could be that the regular contractions that we expect, right, are disrupted. So session 5 of our birth classes, we cover the stages of labor. So if the pattern of contractions gets disrupted, that could be a sign, along with obviously sharp pain in the incision, even between the contraction waves. Okay, that would be the sign. Okay. Let me just share this screen so that we are looking at the questions here. There you go. These are all the questions that are popping up. I was like, where are the questions? There they are. Okay. Being a working mom and 5 to 9, my work evolves around sitting maximum time of the day. What can I do to have? If you can, I don't know how practical it would be, replace your office chair with a birthing ball. Okay. So try to do that. 1 second. Yeah. So try to replace that so that your posture is right. And try to work on that to make sure that your posture is good and make sure that you're more upright, right? So sitting forward, and try to, 1 second. Take small breaks, get up, walk a little bit, stay well hydrated, okay? While you're not at work, make sure you're not sitting. And if you need to sit, like, I don't know, you're cutting vegetables or you're watching TV or something, use your birthing ball for sitting, and more of an upright forward posture. That would help a lot. Okay, inshallah. Can you guys, yeah, okay, I guess I'm going to be switching between both windows because some of the questions are coming in the chat. That's fine, no problem. Okay, so that would be helpful. Try to have other exercises during your evening time. Okay, during the day, try to have those in your day, like try to incorporate prenatal yoga or walking or your hip tilts or swimming, those things in your pregnancy into your birth, into your pregnancy routine, like after work, basically. Okay. Yeah. And if your feet are getting swollen, just lifting up your feet and trying to just walk more, or keeping a small stool to help you with elevating your feet a little bit can be helpful as well. All right. All right. Next would be, next question is, what supplements can help milk supply? So milk supply is going to be things that help with milk supply is basically eating more frequently. Don't stick to 3 meals a day, right? Don't stick to 3 meals a day. Make sure you're having multiple meals a day, at least 5, right? Because your body needs that constant nutrition. Okay. And second thing is you need to add more fluids, like water in general, ORS, oral rehydration solutions, like electrolytes. Have those. Okay. And basically, 1 second. Yeah, I see that question here as well. Okay. Electrolytes are super helpful. You can have things that, such as moringa is helpful. You could add shatawari. These are supplements. But again, remember, all these supplements would not be helpful if you are not. Okay. So you can add tea of fennel, cumin seeds incorporated into your diet. Oats are really good. Fatty fish like salmon helps a lot. What else? Flax seeds, almonds, all of these things are good. But remember, none of these are going to be helpful if there's no frequent stimulation. You can't be eating all of this and just nursing 2-3 times a day, or not nursing on, like, you must be nursing on demand according to the baby's needs. Okay. And that would make a big, big difference to your milk supply as well. Yeah. If you have a question in Arabic or Urdu, you can type it in that language and I'll reply in that language. Okay. If you don't want, if English is difficult for you. Okay. I'm a 3rd-time pregnant mother. My 2 are by C-section. After C-sections, I'm suffering from back pain and pregnancy with relief. You're 3 months pregnant. So if at 3 months pregnant, you're already facing backache, so I would recommend hip tilts. So lots of the hip tilts exercises. Do some psoas release, because where is my pelvis? So this is our pelvis. Our back muscles get tightened, especially if there've been posture issues, if there has been previous trauma to these muscles. So there are these muscles that are supporting our back. We need to release them, right? So there are exercises called psoas release and hip tilts, and then of course using your ball. So these exercises are included in the birth classes, like videos and everything, like diet plans, nutrition guidelines, exercise videos, relaxation, breathing videos, everything's included in the birth classes. Yeah. Thanks for asking that. So all of that is there. So inshallah, you're 3 months pregnant. This is the best time to sign up for birth classes. So if you want to do that, you'll get it. But just let me to answer the question now. So hip tilts can make a big difference. Like the purpose of them is to relieve the pressure or the buildup on your back muscles. Okay. And it also helps get the baby into a very equilibrium position. Yeah, I have a pelvis. I use these props and tools for educating, right? So I use them just so it's visual, right? I've got like cervix to show dilation. I've got things that helps all of these, and I'm planning a few other things. So yeah, just as adults, we are visual learners, right? So this would be helpful. Yeah, inshallah. Also invest in a birthing ball, because I feel when we're sitting right, when our posture is right, it makes a big difference. And then how we are walking, because remember the center of balance switches and shifts a lot. So that can make a big difference. Now there's some questions here. Let me just get into them here. Can the mother and baby be safe? Yeah, if you notice the signs of uterine rupture and you make the right informed decision at the right time, of course, it doesn't mean that la samhallah something's going to happen, right? Like I told you about the cases, I've seen 2 in over 1,000 moms. Okay, since this is my first pregnancy, I was wondering if there is any way to know in advance whether my pelvis is adequate for a vaginal birth. Can be assessed before labor, or do you usually know once labor has started? So Elsa, I love your question, and I feel this has got to go, let us go like a little bit step back. In fact, I'm asking you a question now, so feel free to pop into the chat and reply to my questions. Have you had a pelvic crushing injury? So for example, did you have, like, la samhallah, a car accident, or did you fall off a horse, or something that happened that could have distorted your pelvis? That's one question. Second question, as a child growing up, were you ever so deficient in your nutrients that you had rickets or polio or something like that, that could have impacted your bones or your pelvis in any way? These are 2 things that help us know. There you go. You said, no, I haven't. Alhamdulillah. So if that hasn't happened, then your pelvis is perfectly designed to birth this baby. Okay? Because your pelvis is flexible like this. The tailbone, the coccyx opens up like this. The baby's head, in fact, let me show you the sutures of a baby's head. The baby's head is in 3 portions, right? The skull of the baby is not one solid bone. So it's got these sutures. What happens is the baby's head molds, it elongates, right? And to pass through the birth canal. Now, things that can make it non-conducive would be your birthing position, or a pregnancy where you were not actively active like you should have been. Pregnancy should be active, postpartum should be resting. Remember, you're pregnant, you're not sick. Often what we hear, oh, you're pregnant, yalla, pray on a chair. Don't we all hear that all of a sudden? Right? That, oh, don't walk too fast, don't take stairs. We start treating a pregnant woman as though something's wrong with her. Unless there's a true complication that's preventing you, that's a different story. I'm not talking about that. I'm talking about a low-risk pregnancy where everything's good. So don't doubt your pelvis. Your pelvis is amazing. Have faith in your body. Allah's created is complete. فَتَبَارَكَ اللَّهُ أَحْسَنُ الْخَالِقِينَ. We are like in perfect proportions. And your body would not grow a baby it cannot birth. Yes, things we do could make it inefficient, like we put a woman on her back, and when we do that, we're closing this, right? We don't want that. Okay? And this is where we practice our positioning and everything as much as possible, inshallah. All right, I'm glad you asked this question. Lovely question. I like that one. How can someone know according to scar she's ready for conceiving? Scar, I don't worry about the scar, honestly. If your gap is good enough, the recommended gap between births is 18 months. Your gap is good enough, you're mentally, physically ready, there is no deficiencies, all is good, right? The scar does not decide. Okay, so many have shared their questions in the sharing part. No worries, I'll answer the questions in the sharing part. I don't know why I didn't share there. Yep, I will open, you know what? I'll open the questions in the sharing part. Thank you so much. No worries. Thank you for telling me that. I will answer the questions here and then I'll move to the sharing part. Thank you so much. Okay, I'll just answer this one. I had a C-section 1.5 years back. It was so traumatizing. I was not mentally ready. I consulted with 2-3 doctors. They said I have enough amniotic fluids that they don't risk baby's life, so I have to make a decision to go for it. Whenever I plan, I really want to be back. So inshallah, it's been 1.5 years, so your gap is good, right? So your reason was not a reason that would happen again, okay? My first one was a vaginal birth. Second was a C-section, reasons overdue and cord around the neck. Now, nuchal cord, so cord around the neck. Yes, I have a cord as well. So I have a placenta and I have a cord. A cord around the neck is not a reason for a C-section, right? Because the baby, you cannot strangle a baby. I've seen births, I've attended births where the cord was around the neck 5 times, right? So as long as it's not impacting the well-being of the baby, we do not worry about a cord around the neck, right? And overdue is a statement, like I just told you, we just shared a beautiful story of 42 plus 3. So yeah. But anyway, inshallah, for the next one, you can definitely plan. And I hope to see you in my classes, right? I aim for a gap of 18 months between births. That's my recommendation. All right, let me just answer this one and then I'll move to the sharing one. No worries. Okay, milk supplements we answered. What are the reasons in 2 mothers of uterine rupture when it happened? Which state? So one of them was induced with cytotoxic, like the oral medicine, which is not recommended. I don't know why that happened, where that was happening. So subhanallah, qaddarallah, that happened. And the other one was she started, I can't even remember the other one's story. I think her gap was small. It's been what, 9 years, 10 years. I can't remember exactly the reason why. But she was in active labor. That much I remember. Because she knew when the contraction was coming, but then even between contractions, she was feeling the pain, so she went and got things checked. When to start 2 to 3 meals a day for a baby? 6 months. So introduce solids at 6 months. You can start with some tasting and small portions. And then after 2-3 weeks, you can introduce another meal. By 7 months, they can be up to 3 meals, doesn't matter. Check out my enriching talks. Go to my YouTube. You'll find my enriching talks. I had a very nice talk with one person who's about solid starting. So do check that out, inshallah. All right, let me just check the questions here. Where am I? Here. So I'm sharing this tab now. Okay, let's go to the questions here. It was unbelievable, but it was possible due to tawakkul indeed. Yes, subhanallah, the VBAC after 2C. Why does the cord wrap around the baby's neck? When does it become when it becomes an emergency? The cord can be the baby just somersaulting inside, subhanallah. It becomes an emergency if there is any risk of cord prolapse and if the baby is not doing okay. All right. How to massage C-section scars after 2 months? You can use any oil. And I have a scar massage video that I would recommend. I can't, how do I describe a scar massage? Let me see. I have a pen and I can take a piece of paper. And let's draw a scar on it. Okay. So this is your scar. I need to see myself doing this. So this is your scar, Okay. So you're going to start with around the scar. So you're going to do circles around the scar. Okay. And then you're going to start with gently lifting and releasing, lifting and releasing, lifting and releasing, lifting and releasing. And then gently circles on the scar, right? And then zigzag. So there's a very nice video on how to do all the step-by-step scar massage as well. I don't have the link on me here, but inshallah I'll be happy to share with that. How to take care of I didn't go for Hajj. It was the Blessed Mamas who put together a beautiful Hajj gathering for all the other Blessed Mamas that went for Hajj, mashallah. May Allah take me and everyone again. How to take care of vaginal stitches post-birth. So sits back. So the first 2 days, you want to do some cold compresses. So patsicles, you can pour some witch hazel on it. You can put some aloe vera on it, or just simple water. Just frozen patsicles can help reduce the inflammation. After the first 2-3 days, you start sits bath, so warm sits bath to start doing your Kegels to help bring everything together. Sit on like a donut pillow so you're not applying pressure there. Take your painkillers, that's fine. You can do red light therapy that could help with bringing together all the tissues also and letting that area air dry as well. How to make sure the stitches are less? So yeah, you can do perineal massage. There is now evidence that is recommending that. You can do your Kegels, your squats, your pelvic floor exercises. And main thing at birth, you are more upright. You're doing mother-led pushing, not someone telling you when to push. Okay? Happy to hear all the amazing birth stories. Acknowledge your appreciation for Hafsa. Thank you so much. I'm glad. You're 40 weeks in waiting calmly, which is surprising you. Lots and lots of dua. This is probably one of my blessed mamas, I'm wondering. Yes. So just shoot me a message after the session and let's talk to you and let's encourage you and just thank you for this message. May Allah reward you for this message and may this message be ease for you and everyone else out there. I had a C-section 1.5 years back. It was so traumatizing. I was not prepared. Yeah, okay, I answered that one there. Thank you. All right. Any more questions? Yes, there are questions here. Let's look at them here. Second time I'm here, how to avoid episiotomy. Also want to know how can you recover fast? Okay, that's been answered as well. Alhamdulillah. All right, I think that's pretty much all the questions answered. So thank you so much for asking. If anyone still has a question, you can pop it into the public chat. All right. لَقَدْ خَلَقْنَا الْإِنسَانَ فِي أَحْسَنِ تَقْوِيمٍ. This is what I want you to remind yourself, that Allah subhanahu wa ta'ala, we all have faith on the Quran, that He has created man in the best design. So the sister who was asking about the pelvis, there you go. Your pelvis is perfectly created in the best design, the best shape, the best size, right? So do not doubt it. Do not, even the mother who's struggling with breastfeeding, don't doubt your ability, right, to breastfeed. Your body has everything it needs for it. Yes, we do need support for it. We're not dismissing that it's easy. You do need support. If something's not right, please don't suffer in silence and think, no, it's supposed to work. Maybe you need help with positioning. Maybe you need help with latching. Maybe you are struggling with supply. So let's see how we can help you, inshallah. I do offer online consultations for lactation. And of course, I do want to talk to you guys about my birth classes. So childbirth education classes. We cover pregnancy nutrition, pregnancy exercise with videos, right? Pain management techniques, what a mother needs in pregnancy and birth, how to make the informed decisions, how to tap into her instinct, different birthing positions, different stages of labor, how to do doctor shopping. I've got personal tips and tricks. 18 doctors, remember? What's the best way to speak to a doctor, how to convince them and show that you're confident, inshallah. And I do kind of have some doctors I do recommend in different cities and countries around the world. So yeah, I will guide you on that as well. Don't worry. Alhamdulillah. All right, stages of labor, how our hormones are helping all of this. I will literally make you write your birth plan. It's not normally part of it. Normally we give you tips and you do it. We will be writing our birth plan together, okay? And what is your birth team's role? Like, what is your husband supposed to do? I mean, he wants to help, but poor dude doesn't know how to. So I feel for you, Babas out there. Let me help you tell you what your role is and how you can help. Okay, inshallah. And how to protect your birth environment, how to make the labor easier. And of course, we're not going to ignore complications. We're not going to be ostriches burying our heads in sand and waiting for the storm to pass. We're going to be informed about complications, even C-section preparation. I'll prepare you if it does end up in a C-section. I'll give you tips for recovery as well. Okay. And then, of course, my favorite, postpartum and breastfeeding. And then of anyone, like I always say, my support doesn't end with the classes. Even after your baby's born, if you have questions, it's ongoing until, Allah's allowing me to offer. I'm happy to give, inshallah. And then my best part is the bonus free VBAC module for all women looking for a natural birth after 1, 2, 3, 4 C-sections. Okay, I'm happy to help you and guide you in that. And along with these specific topics that are part of it, all the classes are online. So from your home, you can be in your pajamas, you can be laying down, but don't fall asleep. I mean, I tried not to be very boring. I try to be engaging and try to keep the classes interesting. And it's 25 plus hours of comprehensive education for couples. So please invite your husband. Invite your mom and mom-in-law if you need to. Adi, no problem. Of course, WhatsApp online support groups. And then once you finish my classes, I add you to my whole community, which has groups on everything a mother would need, literally. And if there's something missing, tell me. I'll add that group as well. Alhamdulillah, I love my support groups. Of course, lots of extra resources, exercise videos, nutrition guidelines and recipes, emotional debriefing if anyone needs help in that. The live sessions are weekly interactive with my video on, with my props and tools and everything. I try to do little quizzes and here and there. All right. And you have access for a whole year, right? It includes a VBAC component. It has a 172-page PDF handout with it as well. And of course, the prices are immensely discounted. I have it available in English, Urdu, and Arabic, and it is the only Islamic faith-based program. So yeah, what are you waiting for? Yalla, sign up. This mother's testimonial was beautiful. It's one of the most recent ones. So I've got I was looking through the list of testimonials that I get, and I was like, oh wait, there's more than 200 up there. I don't have time. I was like, let's just pick up the last one. Alhamdulillah. So she says the childbirth education were extremely beneficial and helped me prepare both physically and emotionally for birth and parenthood. I especially appreciated how the information was aligned with Islamic values, reminding us to place our trust in Allah, while also gaining the knowledge needed to make informed decisions. The classes increased my confidence, reduced my fears, and taught practical skills for labor, delivery, and newborn care. I would highly recommend to all the expecting parents, so all of you listening to me now, yalla, yalla, seeking both beneficial knowledge and an Islamic perspective on this important journey. A special thank you to Hafsa Baji, that's me, who was more than just an instructor. Alhamdulillah, may Allah accept me and make me like you all think of me. She became like a mother figure. Well, yeah, kind of. I've midlife kind of situation here. I'm old enough now to be a mother, I guess, for most of you little girls. Mother-like figure to me during this course, always teaching with patience, kindness, and genuine care. Her support, encouragement, and sincere concern made me feel safe and understood. I have so much love and respect for her, and my love and respect right back at you. And I pray that Allah rewards her abundantly, blesses her efforts, and places barakah in all that she does. Allahumma barik. Ameen summa ameen. And she wholeheartedly recommends these classes to every expecting parent. Thank you so much, my dear, dear sister. These are anonymous testimonials. I don't even know who wrote this, but I just love you. Thank you so much. May it be mizan hasanat, may it be sadaqah jariyah for you if from this testimonial a mother signs up and benefits. So it's an ongoing thing, subhanallah. This is my little flyer about all the specialized workshops I have as well. These are obviously, you don't need to all my qualifications, and there are some happening in the process right now as well. So I'm offering childbirth preparation classes, breastfeeding consultations, doula services, VBAC support, and then I have specialized workshops on breastfeeding, pumping, newborn care, increasing milk supply, breastfeeding in Ramadan, VBAC, starting solids, toilet training, weaning from breast milk, baby-led weaning, writing your birth plan, labor preparation, and then if something's missing, tell me. I'll try to add that as well, inshallah. So yeah, that brings us to the end of today. And you can find my phone numbers on the screen. You can find my email on the screen. And if you scan that, you'll find my, my Instagram. right? That's where I share all these birth stories and the next upcoming events. The next birth classes are starting July 20th. So in 2 weeks' time, تقريبا, less. Seats are filling up fast. I think I just have a very few seats left. This group is going to be the Urdu English group. So if anyone speaks that language, and then the next English ones, we have one group currently ongoing. We just started. The next one would be in August. Okie dokie. So, yep. And then I have demand for an Arabic group. We have, I think, 3 or 4 mamas. I need a couple more. And then we'll go ahead with an Arabic group if someone is interested as well, inshallah. I haven't set dates for that. Alrighty. And we're done. So Jazakumullah khair, everyone that joined us today. It was lovely to have you. I love the questions. I love the sharing. Some beautiful, beautiful, beautiful sharing happening. Let me see if there was any more sharing that I missed. Nothing here. And let me just quickly check here. Okay, alhamdulillah. All right. So, yeah, ya'tikum al-afiyah. Let's just recite the dua, and then I'll be here for a couple of minutes if someone has any last-minute questions. So, subhanallahi wa bihamdihi, subhanakallahumma bihamdika, nashhadu an la ilaha illa anta, nastaghfiruka wa natubu ilayk. Jazakumullahu khairan. I hope to hear from you all soon. So just buzz me on direct on these WhatsApp numbers, and I will definitely answer. And yes, even if once you do sign up for the classes, your number gets saved and add a little label that this is my blessed mama. So if you have any questions, even if you don't want to ask in the main group, you can always buzz me, and you do get priority for direct WhatsApp support as well throughout pregnancy and beyond. Okay. The next class, Fatima, starts July 20th. But you can sign up from now because there are some prerequisites that you need to do. Some short videos you need to watch from before. Okay. Yep. That's it. Thank you so much. Jazakumullah khair. Yatikum al-afiyah for everybody that joined. And we can end this. I will try to upload the recording of this, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuhu. I hope this session was beneficial for all of you. And I hope to see you in our future sessions. I am planning an enriching talk soon. And then there is some demand for some workshops. So you know what? I'll send a poll and see what we need more so that we can connect again and again, inshallah. I'd love to see. And please help spread the word for if they were not here right now, if they could benefit. May it be sadaqah jariyah for you as well. All right. Assalamu alaikum wa rahmatullahi wa barakatuh.